Avoidance is the opposite of exposure, and exposure is the gold standard of managing anxiety.
Welcome to the eighth episode of our new podcast, the CHC Podcast, Congenital Heart Conversations. I am Anna Jaworski and a heart mom to an adult with a single ventricle heart. I have two co-hosts with me here today, Annie
I'm Annie Ulchak, and I'm a congenital heart patient.
and Ayrton.
I'm Ayrton Beatty, and I am a bereaved heart sibling and also a congenital heart patient.
I'm so excited for Annie and Ayrton to take over the interview portion of this episode. I'll be wearing a producer's cap today. I'll be back at the end of the meeting with my co-producer, Nicole Bilodeau, to talk with Annie and Ayrton about what we've learned from the panel discussion. Take it away, Ayrton.
Today's town hall meeting deals with mental health. This is a hot topic in the news right now. It seems as though, especially since the pandemic, more people are aware of what isolation, trauma, and illness can do to a person's mental health.
Those of us living with congenital heart defects are all too aware of how we can feel isolated, how our physical health has been compromised at different times in our lives, and anyone who has undergone open heart surgery has suffered from medical trauma.
Richard Schwindt is a therapist, a social worker, and the author of Emotional Recovery from Congenital Heart Disease and 25 other books. He is also a father and a grandfather. He and his grandson have both had multiple procedures for their congenital heart defects. Richard's career in mental health has spanned over 4 decades, and he enjoys helping patients, especially congenital heart patients, manage their anxiety and live life to the fullest.
Jennifer Angeloni is a tautology of Fallot patient, licensed mental health clinician, and an advocate with Young Mended Hearts. Jennifer works with the Echo Dance Collaborative.
Melissa Kotlenberg is a certified holistic health coach who helps women take control of their health and wellness by helping them prioritize nutrition, exercise, healthy lifestyle habits, and natural solutions so they can live focused and energized lives. She's also a mom of 5 and a heart mom to 14-year-old Tyson, who was born with severe congenital heart defects, which required 3 open heart surgeries by the time he turned 2 years old.
So, question 1 for all panelists. Did CHD play a role in your discussion to go into the mental health field? And if so, how? Richard, we'll start with you, please.
It probably did. I didn't think of it explicitly at the time, but I was in a position where I had to do a lot of coaching for myself when I was young and try to find ways of dealing with the world and engaging with the world. I think that very much forged the person I turned into. And therefore, when I had to make a decision about a career, I was very much drawn to helping others. I had that role in my family, I had that role in my life. So, yeah, I would say that not only did it draw me into it, but it very much forged the therapist I turned into.
Wonderful, thank you. Jennifer?
I do think that CHD had a role in my decision to go into the mental health field. When I first thought about it, I thought about it from the perspective of helping the healthy siblings. My brother and I had a pretty tenuous relationship growing up, and me being the younger sister, the child in the family who needed a little bit more, there was always this tension between us. And I think when I became a young professional and I was in college and I noticed how someone who was chronically ill impacted not just the parents, but also the siblings, I really thought about it from the perspective of I want to help the ones who are having to deal with it, but not the patients themselves. However, as I've gotten more mature in my professional career, I find myself really enjoying the work with heart patients too.
Wow, thank you. Melissa?
For me, as a certified holistic health coach, I help individuals to take control of their health in natural ways. And we look at things from a holistic perspective, right? All of the different systems, the body is very connected: mind, body, and spirit. And so, being a heart mom and having experienced all of the things that I have gone through with my son, you can't go through something like that without it affecting your mental health. In the very beginning of our journey with all of the open heart surgeries and the cardiac catheterizations, we just lived in survival mode. But once we discovered some natural ways to help boost my son's immune system and manage his respiratory health, what I found is that as my son started to struggle less and less physically, I realized that I was becoming more aware of the struggles in my mental health. So I was diagnosed in 2016 with PTSD and anxiety. I've been to 3 different counselors. So over the years have learned a plethora of tips and strategies to support my mental health. So yes, I am very passionate about helping other people and walking alongside them in their journey with mental health. And I love being able to add natural tools to their toolbox. So yes, my position as a certified holistic health coach was very much influenced by the journey that I've been through with my son.
Great. Thank you.
Melissa, considering all that you and your son have been through together with his congenital heart defects and surgeries, you've obviously found natural ways to manage your mental health. What advice can you give other heart moms about how to manage stress in their lives and support their mental health?
As I mentioned before, managing mental health is not a one-stop shop. So what's going to work for me isn't necessarily going to work for everyone. And so I think that it's a great idea to combine lots of different tips and strategies to be able to support yourself in your mental health. And some of the things that have worked for me have been things like staying on top of my nutrition. We all know that proper nutrition is foundational for our health. So I try really hard to eat clean, whole foods that come from nature. I try to stay away from processed foods because I know how my mental health is very much affected by what I eat. I try to avoid alcohol. Of course, I enjoy a glass of wine or two when I'm out with friends on the weekend, but for the most part, I know how alcohol affects me mentally. So I try to steer clear of that. Caffeine is another thing. Sugar is another thing. And so those are just some of the things that I try to do on a daily basis, staying on top of my nutrition. I feel like that's really important. Another thing would be movement. So every day I move my body in some way. We all know movement is life. And I purposely choose the word movement because when I say exercise, people have a negative view of exercise. So I call it movement. So really doing what we love. The best exercise is the one that you are going to do. So whether that's hiking, yoga, Pilates, playing soccer or hockey, going for a bike ride, it's just so wonderful to have those endorphins released in your brain. It's those happy hormones that keep you going, helps us deal with stress, helps us break that cycle of negative thoughts. Another tip that I like to do every single day, and I try to fit this into my schedule wherever I can. For me, it's usually early morning, but I take time every day to get quiet. So shut off the noise that is my brain, ground myself, focus my thoughts so that I can try to stop that stream of jumbled up thoughts that are crowding my mind. For me, what that looks like is spending some time in devotion and prayer. I'm a Christian, so I like to give part of my day over to God. For others, that could look like meditation, mindfulness, yoga, affirmations, visualizations, even journaling. Journaling is another great way you can journal some gratitudes to really help you to get your day started on the right foot. And then lastly, another thing that I incorporate into every day is a little bit of aromatherapy with some deep breathing. So I use essential oils to help keep me grounded. And the oils, they send signals to my brain to help me calm myself. So they lower my heart rate, they slow down my breathing, they lower my blood pressure. So for me, not a day goes by and not a night goes by where I don't have my diffuser running. So those are just a few of the things that I have found in natural ways that we can support our mental health. So nutrition, movement, getting quiet, and using aromatherapy. And that's what I have found to be really helpful. I'm basically one of the few heart moms that is not on some kind of antidepressant or anti-anxiety medication. And I don't say that with any hint of judgment whatsoever, because we all need to do what we need to do to survive and to get through. And so if medication is something that you find helpful, by all means, we have to do what's right for us. But I just have been pretty stubborn about not going on medication. Because of that, I've done a lot of research on finding natural ways to manage my mental health, and that's what works for me.
Wow, thank you so much. Jennifer, what are ways you help other patients and their siblings cope with cardiology appointments, tests, and hospitalizations?
Something that I really like to remind the clients that I work with is that they have control, especially if they're an adult, that they do have control over what's happening to them in the appointment. And if I'm working with a client who is a minor and doesn't necessarily have the agency or autonomy to make some of those choices, to really help the parent in that moment, tell the doctor, hey, listen, my kid is very anxious right now. Do you mind taking things slowly? So, the very first thing that I like to help patients with and my clients with is reminding them that they do have a voice and that they do have control over what is happening. Obviously, if we have to go for tests or hospitalizations or we need certain procedures done, I think it's always really important to ask questions and say, hey, can you show me what this looks like? Or can you send me a video of what this looks like? I believe that the more information patients and clients have, the better they feel and the more control they're going to feel in that moment. And once we feel like we're safe and we're in control and we have all the information, we can then go into those appointments and hospitalizations feeling a little bit more confident that we'll be able to know what to expect and be able to have the outcome that's the best for us. When it comes to siblings, I think the most important thing is telling everybody the same pieces of information. I remember growing up and my brother would get the information and I would not. He would always be told, Jenny's going to go have this, Jenny's going to go have that, because he's older. So I think my parents thought he'd understand it a little bit more. But for me, I was given the watered down information and ended up feeling more fear. And then later on in life, he would say, oh, we're going to go here and you're going to have all these horrible things happen to you. And he'd weaponize the information. But I think being able to tell patients and their siblings the same information at the same time, and then also welcome questions from them as well. Because especially if you're working with kids, it's really important to answer their questions because that's what they can do. And that's what they can advocate for.
I couldn't agree with you more. Thank you.
Richard, what general advice do you have for patients with CHD experiencing acute PTSD induced and chronic anxiety? What practical tips can you give the listeners?
There are lots of practical tips out there, and I endorse what Melissa was saying and Jennifer as well. There are lots and lots of ways to approach anxiety. I have my own approaches. I use CBT and hypnotherapy to help myself and help others. The challenge to a great extent is philosophic. If you have not fully engaged in managing your anxiety and facing the fears that you have, you're not going to find it as easy to get past all the different things that happen. You can find yourself very easily triggered. I was triggered a few weeks ago by a nurse who started talking over me about anticoagulant bridging. And I found myself becoming increasingly upset irrationally and had to really go inside myself and start doing all my stuff in order to deal with her, but also in order to manage my own emotions. There's a very big philosophic aspect to this, in so much if we don't commit to fully engaging with our anxiety, fully engaging or getting treatment if we need it, or something like PTSD, we will not be able to carry on in our lives properly. And these things will come back and plague us. Avoidance is the opposite of exposure, and exposure is the gold standard of managing anxiety.
Wow, that was wonderful. Thank you so much. Question 3 for all panelists. What advice would you give to other parents and CHDers about dealing with bullying, either as patients or family members? Melissa, we'll have you go first, please.
Yeah, that's a really tough question. I think, especially because many of us here on this call are moms, right? So, if we've been in a situation before where one of our kids has been bullied, I'm sure that, I don't know about you, but I can feel that right in my gut. We did have a situation, unfortunately, when my son was quite young, grade 3 at the time. So, about, I guess, 8 years old. And he was being bullied by a child who was older than him. And yeah, the first thing that we did was hear him and make sure that we were responding in a way that validated how he was feeling, recognizing his feelings and recognizing that this was happening. Yeah. And then down the road, it did get to the point where the bullying did need to be reported. But one of the things that we tried to instill in our son was to, as much as it's so difficult, to try not to react negatively to the bully, because many times that's exactly what the bully is looking for. They're looking for an explosive reaction, right? They're looking for either anger or retaliation or tears or fear or crying. We just really tried to encourage him not to react. We encouraged him to find someone he felt safe with and talk with that person or hang out with that person. And we were thankful that eventually the bullying did stop. We did have to get involved with parents and get the school involved, but we are very thankful that things were handled really well. The kids were really young at the time. So I think in some ways, when kids are younger, it's just like a phase that they go through, right? Whereas bullies who are older, like maybe into their teens, this is a lifetime of trauma that they are reacting to. And so it can sometimes be harder when they're older. Thankfully, we are in a position now where we don't have bullying in his life anymore. And as parents, we're always on the lookout for our children to be on the other end, right? Like, we're always the ones saying, be kind, love everyone. If they say something at the dinner table that sounds negative, or they make fun of somebody's glasses or their hair or whatever, we really try to nip that in the bud right away and don't even allow that kind of conversation, because we really want our children to be accepting and loving of everybody.
It's wonderful you teach that. Richard?
My professional specialty is actually adults bullying adults, and I've actually written 3 books on that. Good things came to mind thinking about what Melissa was saying as well. It is important, especially if we're talking about bullying of children, which is a different phenomena than adults bullying adults. But if we're talking about children, we want to do everything in our power to engineer, because it is adults' responsibility, a safe environment for our kids, which means not neglecting it and engaging it full on. Another thought that I had was, if you could see me, I would be closing my hands together to demonstrate a narrowing lens. Because when people are bullied, their lens narrows until all they can see is the bullying. And a lot of the treatment, especially with adults, but with children as well, involves rewidening that lens. The more narrow the lens gets, the more anxiety provoking, the more frightening, and the more at risk a child is. The wider the lens, the people who don't bully them, their family life, maybe their religious life, whatever else is in their life is going to be a protective factor for them. A child who is alone in their shame, and we have to remember that these days, a lot of the bullying is going to take place online or on social media. But the child who is alone with that is at far more risk than the child who has a large supportive group of people around them, other interests, other activities, and other things that fill them up.
Yeah, that's great. Jen?
I agreed a lot with what Richard and Melissa have said so far. I would add that it's really important to teach children humility and to remind them that the person who is interacting with you in this way is doing this because they are hurting really badly. And to teach children humility and compassion from a very young age, not so much just in the service of being a good person, because being a good and kind person is always great, but to be able to teach children and those around you that having compassion is a superpower, and being able to look at a person who is requiring love in a very unloving kind of way requires even more love. I've worked with youth who have been the bully, and I've worked with youth who have been bullied. And on both ends of the spectrum, they don't feel good. It's always really important to remind these families and folks who have CHD that this other person could be hurting in a very unique and internal way. And it's so important to use that superpower that we all have as CHDers of compassion to know almost instinctually how it feels to have our hearts touched by somebody else. I do genuinely try to put that strength back into CHDers and their families and say, you have this superpower of being able to know what it feels like to have your heart touched, and you get to do that for other people too. When bullying gets to the point of harassment and it becomes physical, or it starts to really become detrimental to the victim's mental health and physical health, then sure, interventions need to happen. I think sometimes parents and schools, if it's happening with children, mislabel bullying, and things often get classified as bullying that isn't always bullying. But I think a great antidote to bullying in general is to teach children to look at the world with compassion and to be able to say, hey, I can sense this person is really struggling, and I'm just going to be kind because it seems like they really need it.
Jennifer, teaching someone about a superpower with compassion and humility is absolutely a wonderful way to put it. And I feel as though if we are able to teach at a young age something like this, it would turn so many lives around, so many thought processes as they go through life.
I want to thank all the panelists for sharing. And when we come back, it will be time for the town hall audience to ask questions or share their experiences with us.
The CHC Congenital Heart Conversations podcast is a presentation of Hearts Unite the Globe, or HUG, and is part of the HUG Podcast Network. HUG is a nonprofit organization devoted to providing resources to the congenital heart defect community to enrich the lives of our community members. For free CHD resources, please visit our website at congenitalheartdefects.com.
You are listening to the CHC podcast. If you have a question or comment that you would like addressed on our show, please send an email to Anna Jaworski at anna@thechcpodcast.com. That's anna@thechcpodcast.com. Now, back to the CHC podcast.
Welcome back. We're talking about mental health in today's town hall meeting. And now our audience is able to share their experience or ask questions of our panelists.
Michael has a question.
I'm not sure if it's a question or just a comment. I was touched by what Jennifer had to say about siblings and talking to the siblings of the CHD patient who was going to have a procedure, because my daughter was autistic and her first surgery, she was very young. She was 2 years old. She had procedures through more or less 5 or 6. And I remember one of the procedures, we didn't get around to telling her what was happening. And we took her to the hospital and we had to wheel her through. And she's like really excited because wheeling through the hospital in this baby crib bed kind of thing was cool. And then it dawned on her that this wasn't going to be a lot of fun. And I think we made a mistake by not prepping her, because I didn't know how much we could prep her. And I think the other kids knew more about it than she did. And looking back on it, I think that was probably a mistake. On the other hand, she had a pacemaker when she was 2, and somewhere around age 10, I asked her, because we had always gone through this routine, the heart goes boom, and the pacemaker goes tick, tick. One day I asked her, I said, does everybody have a pacemaker? And she said, yeah. I said, no, it's just you. And she was a lot less than happy knowing that. So I think I had to feel my way through doing that. I think I probably could have done it better. So what's the general rule on that? We sit them down. At what age can we tell a kid who's going through surgery, you're going through surgery?
I think it's thinking about it from the perspective of the child and understanding what do they really need to know in this situation. Do they need to know all the ins and outs? Are they old enough to truly understand that? I just had a client of mine who is under the age of 10 go in for surgery, and it was her first open heart surgery. She had a procedure done before, and she fully understood what exactly was going to happen. They knew they were going to have to make a stitch on her chest. And we chose to explain this to her and her younger sister at the same time, and to say, your sister is going to have this procedure done. She's going to be going to sleep while this happens. She's not going to feel any pain during that moment. And so I think leaning into sharing information to children at an age appropriate level is really important. And this is what child life specialists are for also. So if you do have children who are younger and you're struggling to come up with it, and there isn't necessarily a mental health professional in the room who can explain this, most hospitals have child life specialists who can come in and really explain it in a meaningful and productive way.
Thank you. I just think that it's hard to say. I felt that we were feeling our way through it. I think autism was at some point much more daunting to us than our actual heart condition. It's pretty serious. And she was the youngest child to boot, and the other kids were very close in age. I appreciate the advice. I hope other people can hear it and do better than we did.
Listen, if I can offer a point of view here, I'm a nurse anesthetist. I work in the hospital and I give anesthesia for surgery. And I talk to patients before and after. And I don't usually work with children, but I do work with a lot of adults. Let me tell you something. A lot of adults, it's hard to know what to tell them or what they want to know. So it's not just a question of children. You'd be amazed how many adults don't really want to know technical aspects of their anesthesia. Some of them want to know everything. Most of them just want to know, am I going to sleep? How will I wake up? Simple stuff like that. They get overwhelmed very easily. Yes, advance notice. The big difference between adults and kids is advance notice. Adults want to know as far in advance as they can. Kids, you can pop it on the week before and say, we're going to the hospital. You're going to be sore when you wake up, things like that. In my opinion, that generally works okay. We had a procedure for Alex. It was a non-cardiac procedure. And it was for his teeth. And we took him to the hospital beforehand, and he put a gown on and went to the room and got shown around and that kind of stuff. And that was good. And a lot of hospitals do that so that kids have an orientation to the environment before the day of the procedure. That works out pretty well too.
Thank you, guys. I appreciate that. Melissa, I see you have a question there.
I just wanted to make a comment. And Michael, I think you need to give yourself a little bit of grace, because we do the best that we can do with the resources and information that we've been given, right? So give yourself some grace there and just know that you did what you felt was best for your daughter at the time. My opinion on this is that it really depends on the child and the anxiety levels of the child. So for example, our son, he's 14 now, so he can handle it now. But when he was younger, he hated blood work and he would be terrified of blood work. And if he knew a week ahead of time that he was going to have blood work, he wouldn't sleep. He'd be up through the night a couple times and he would just be so beside himself with worry. So my husband and I made the decision to not tell him that he was having blood work until about 10 minutes before. And sometimes we even doubted that decision, because that would often end up in a meltdown. And we did have child life specialists come and explain things to him and that sort of thing. But it really just depends on the child. If it's going to cause a huge amount of anxiety, then maybe it's best to give them enough time to mentally prepare, but not enough time to sit and stew and worry over it.
Yes, I agree. I think you have to take each child individually and understand when and what you can say to make sure you have the best outcome for them.
That's great. And now we'll give Richard a chance to weigh in on this.
I do concur with what the other people are saying. You definitely have to have a sense of the child's cognitive level. And within the ability that you can, you have to be as close to the truth as you can be. But again, that's going to vary. Some people will tend to over explain and they'll lose the child along the way. I've had to have a lot of difficult conversations in my career with children. And my experience with it is that they will take things in and process them a little bit differently than adults. And if you are careful and precise in what you say, that will be processed in the child's mind. If you do hypnosis with a child, they're going to squirm around, look like they're not paying attention, look like they're not hypnotized, and walk away, and all the work will have been done anyway. Their minds will pick this stuff up. So if you have a couple of things that you think are important for them to understand, maybe it's about a procedure, maybe about the fact that they're going to be supported, maybe that they're loved, and you make those points in a very clear, simple way, it is going to stick. And we'll make mistakes because we do. That's not a big deal. Loving parents make mistakes. They're still loving parents and they don't screw up their kids. I don't think there's any reason to be hard to yourself if you don't say exactly what you hoped you could have said.
Thank you, Richard. I actually have a question for you, a little bit on what you were just talking about. So you mentioned CBT in hypnotherapy. I myself, as a patient, have received and continue to receive CBT therapy due to the fact of my many medical traumas that I honestly thought was not a trauma until I got older and ignored the traumas that I did have, thinking they were quote unquote normal. And now I'm able to move forward with some things, but I feel stuck at times and curious a little bit about this hypnotherapy as something that maybe us CHD patients might be able to work into with our therapy.
I belong to the Canadian Society for Clinical Hypnosis and I've trained with the American Society for Clinical Hypnosis. We are all often in trance states. We're in trance states often when we're driving, and we're in trance states when we're frightened. I was taught once about emergency room hypnotherapy, and the person who was making the presentation said, somebody asked, what kind of induction do you use with someone in an emergency room? And he said, you don't have to. They're already in trance. So essentially, what happens when you're in a trance state, whether you're just zoned out or somebody has formally put you into a trance, is that the route to your unconscious mind is far more direct and you're far more suggestible. So one of the things I do with myself or I do with others, and I had to do this I'm going to do it tomorrow for a small dental procedure. I'll put myself in a trance state before I go in for the cleaning. One of the things I do is create some positive, simple messaging. Time will pass quickly. You'll feel little. You'll remain comfortable and safe throughout the procedure. And I do that virtually every time I go, not to complicate it too much because you can go for years and years talking about hypnotherapy, but there's a lot of good things that you can draw from it that can be used in day to day life, used in managing fears, and used in dealing with procedures and other medical traumas as they come along.
Wow, thank you. Anna, I see your hand is up.
Yes, my question regards control. I'm wondering if one of the reasons why people end up having anxiety over the medical procedures they have to endure is because they feel that things are being done to them and they don't have control over the situation. So, Melissa and Richard and Jennifer, could you respond to maybe ways that we could empower patients to feel that they do have some control to help them endure their procedures with less trauma? Let's start with
Sure.
Melissa.
Okay, thank you. I would say that is if we can give our kids as many options as possible, I think that would be really helpful, especially for the younger ones. So even just simple things like what color band they want around their arm, or I'm just trying to think of some of the options that I gave. If I knew that he had to have blood work, would you like to do your blood work before the echo appointment or after the echo appointment? Would you like to get this over with now, or do you want to do it at the end of the day? Just feel if we can give them some kind of control with some of those decisions, then it can settle in their brain that they realize that the blood work or the procedure is non-negotiable. But in the process, we can give them choices so that they can feel like they have some kind of control.
I love that. I tried to give my child control as much as we were able, but so many times, especially in a pediatric cardiology office, it's hurry up and get this done. And I feel that the children's options are very limited, if there are any. So I think that's something that we need to go into with a conscious mind or a mindset that we want to try and do that. Jennifer, do you have any suggestions on that?
Absolutely. Something that I really learned early on in life is that having information means having control. And I think when kiddos go into procedures, if we say, okay, here's what you can know, here's the information. How do you feel about that? I think first asking children when you give them the information to allow them to pause and actually think about their feeling and to feel their feeling. Because often what will happen, and this is true for anybody in their brain, is that if we're in a state of fear, we're not really going to have the faculties to be intentional about being empowered. I think giving kids an opportunity to hear the information, hear what's going to happen, and then ask and follow up. How do you feel about that? Do you have any questions? Do you want anything to be a little different? And letting them, again, obviously, this is very age specific, but allowing them to say, I don't feel good about that, or that makes me feel scared. And not just saying, okay, this is something you have to have anyway. So we're just going to have to buck up and deal with it. Being able to say, okay, I understand you feel afraid. What are the things that you're fearing? And really helping kids and patients, I think of any age really, to deconstruct where that fear might be coming from. Because then once they have control over what it is, they're going to go in feeling a little bit better. They'll be able to say to themselves, all right, worst case scenario, this is what's going to happen, but I'm in a hospital and this is the best place to have that happen, which I also have to tell myself every time I go in for a procedure, hey, if anything bad happens, at least I'm in a hospital and there are people here who care about me and there are people here who are going to take care of me. So I think when it comes to control, yes. And allowing kids to know or patients to know all the important details will give them that sense of control because there isn't necessarily a control over what has to happen, but they can certainly control how they feel and how they think about it.
Yeah, I really like that. I wish we had more time with the children. I feel like a lot of times everybody's in such a rush that they don't stop to ask the children, are you okay with this? And I think a lot of times the kids would say, no, I'm not okay with this. I know for our child, especially when it came to needles, there was not an easy way to handle that. Our way of handling it was thanks to our older son, as a matter of fact. He came to an appointment and my older son said, hey, buddy, just squeeze my hand and say Domino, which was his dog's name. And it'll be over before you know it. So everyone in the hospital ended up knowing Domino by the time we were done.
It's too cute. Yeah, for myself, it was nothing but screaming and crying throughout the whole thing until I had the CBT. Richard, did you want to respond quickly?
Yeah, Annie, the CBT thing has really helped me in a lot of ways. And it can be taught to children as well. There's a resource, I believe, called Coping Cat, or maybe I'm out of date. It's been a while since I've worked exclusively with kids, but kids can pick up the idea of what a cognitive distortion is. They can pick up the idea that their thoughts affect their emotions and start making that link and making that connection. And the minute they can take a step back, it will be more powerful for them. The needles are such a flashpoint for so many CHD people. I've had a phlebotomist ask me if I was a IV drug addict. And I said, no, just CHD.
Hmm.
I've had lots and lots of needles stuck in that arm. And it was something that I and probably most people eventually have to come to terms with. But over time, I found ways, one silly way. I remember a resident, or not a resident, even an intern or medical student who was trying to put an IV into me and missing every time. Behind him was standing the IV nurse, and just watching her face instead of him made all the difference because she was making so many faces at what this idiot was doing. So I almost laughed, even though I was having needles stuck in muscles and stuff. But people can be taught, and it sounds like the CBT is helping you, and it can help anybody. I would certainly review for myself going into procedure, either do a thought record, which is a CBT technique, or start reviewing cognitive distortions. I'll just give you one quick example. If you have a medication that's new and you look at the side effects and mild stomach upset, mild headache, mild tiredness, massive stroke, which one of those things is going to catch your attention? Now, what they may not tell you is that there's a 1 in 10 chance of the mild headache, 1 in 10 chance of the mild fatigue, and a 1 in 10,000 chance of the massive heart attack. But we naturally gravitate towards the extreme. And understanding that dynamic is going to help us begin to analyze where our emotions and where our thoughts are on that situation.
Before we end this segment, I hope I'm not the only one. I imagine some of our listeners too are going to be saying, "What is CBT? I don't know what that stands for." Richard, can you tell us what CBT means?
It stands for cognitive behavioral therapy, and it's a very common form of therapy that can be done in different ways with a therapist online through books. It is a combination of cognitive psychology and behavioral psychology, and it is a very effective way of learning to manage strong emotions like fear, anxiety, depression. So it's a good technique to pick up. And again, as I said earlier, children can pick it up. It can be taught to children. It can be very effective with children.
I think I need to learn this technique.
It's amazing.
It is a really good technique. I've had it taught me for help with PTSD for being in abusive relationships, and it has been really beneficial to my life. I would like to say thank you to our guests, Richard, Jennifer, and Melissa, for joining us. And when we come back, we will be talking with our producers about today's podcast. Thank you, Melissa.
You're so very welcome. And thank you for inviting me to be on this podcast. And I am so thankful that I learned a few things myself too.
Thank you, Jennifer.
Thank you all. Thank you to Annie and Anna for inviting me in here. I feel so very blessed to be a part of this community, both as a person, but as a provider. So thank you.
And thank you to Richard.
Great being here. Thanks for having me.
Anna Jaworski has written several books to empower the congenital heart defect or CHD community. These books can be found at Amazon.com or at her website, www.babyheartspress.com. Her bestseller is The Heart of a Mother, an anthology of stories written by women for women in the CHD community. Anna's other books, My Brother Needs an Operation, The Heart of a Father, and Hypoplastic Left Heart Syndrome, a handbook for parents, will help you understand that you are not alone. Visit babyheartspress.com to find out more.
This content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The opinions expressed in the podcast are not those of Hearts Unite the Globe, but of the hosts and guests, and are intended to spark discussion about issues pertaining to congenital heart disease or bereavement.
Welcome back. Now it's time for producers Anna Jaworski and Nicole Bilodeau to talk about this episode with me, Annie Ulchak, and Ayrton. Anna is a heart mom, and her co-producer, Nicole Bilodeau, discovered that she had a CHD as an adult. They were working behind the scenes during the town hall meeting.
I just thought this was a fantastic episode. I learned so much. I want to have every one of the panelists on Heart to Heart with Anna. Again, I already had Richard on the show once, and that's why I was happy to have him come back because he's so knowledgeable, both as a patient and also as a clinician. But I never heard of CBT or cognitive behavioral therapy. So that is something that I feel like maybe everybody needs to know that. So if I didn't learn anything else, just learning about CBT and that there is a form of therapy to help you deal with those extreme emotions, I think that's a really great takeaway. What do you think, Nicole?
And this was a really good episode. I spent it partially in tears and partially furiously scribbling notes of stuff to look up later.
Hear you.
There are definitely some tips and tricks that I will be taking away from this. I thought it was interesting when Jennifer had mentioned allowing pediatric patients to feel like they have some kind of control, because it was literally 1 week from diagnosis to surgery for me. And I feel like that week I had no control. It was, you're going for this test, here are your results, this is what we're going to do. And I was trying to understand what was going on. But then, because I'm an adult, I'm the one that has to explain everything to my family and friends. And at the same time that I'm trying to process everything, I'm also trying to help them process their thoughts about it and be strong and say, no, I'm going to be fine. They say I have a 99% survival rate. I will 100% be fine. But when I was by myself, I was an absolute basket case. So all of these things would have come in handy at that point.
I know, right? I think when you're given a really terrifying diagnosis or prognosis for your child, I think that should come with a therapy session. I really think that at that point, and Frank, I don't know what you think about this, and I don't know if I would have been as accepting at that moment as what I would be now, but I think it's traumatizing to be told, oh, you need surgery within a week. I'm so sorry. You don't really have any choices here. If you want to survive, you need this. We were in a very similar situation, except we were given options. Our option was to do nothing and our child would die, or to do an experimental procedure and our child will probably die. So, in either case, we were not being given good news. And I know that I suffer PTSD from that experience. Frank, as a nurse, what do you think about when patients receive really frightening news? Maybe there just aren't enough therapists around, but what do you think about maybe doctors also saying, do you think it would be helpful to talk to a therapist about this?
I could see that being an option. There's a couple of limiting factors there. One of them is the limitation on number of therapists that exist. As it is, the therapists I know of at our hospital are loaded down. I don't know how you would fit them into the schedule, or if you would have somebody on call in the hospital who can go talk to somebody like a social worker, but a therapist who'd go see them. Another thing is, I'm not really sure how you would decide how emergent it is to require a therapist as opposed to, is a week, a month, 2 months? What's the cutoff where they have to see somebody right now versus go home and process it with their family? I don't know. And some people have their own resources. They have good relationships with their spouse, and they can talk with them. They have a clergyman they can talk to, whatever it is. So the idea is great. Implementation, I'm not sure how it would work.
Yeah, I know the implementation is probably the biggest problem with this, but I really think that we are becoming more aware of the mental health issues that surround having a chronic illness or having a child with a chronic illness. And I don't feel there's enough work that's being done to help families process that. Just like Nicole said, because she was an adult, they just assumed, oh, you can handle this news. Oh, and you can be the one to explain all of this to your family members and have to handle it all by yourself. Even if you had a spouse, that kind of news would be frightening for a spouse. I just feel like we need to be doing something to help people to get through this. I think Michael has something he'd like to add to the conversation.
Yeah, I would. Thank you. I think what we've talked about here today is helpful not only to children and not only to CHD, and I can speak from my own experience. I recently had some major surgery, and about 2 weeks before the surgery, I met with doctors, not necessarily the ones who would be there, but I met with doctors who explained in greater detail what was going to happen. In particular, I met with an anesthesiologist who I found very calming. He said, "You'll be asleep, you won't feel anything, you'll wake up, it'll be over." It was the kind of thing I needed to hear, even though I think I already knew that. It's not my first surgery, but it was very helpful. And again, I think what we're getting here today is useful to anybody going through any procedure of any kind and not necessarily CHD. And I thank you for that, because I think it's important to see the universality of the fear of procedures inside your body. It's just very scary.
Ayrton?
Yeah, it was interesting that during the pandemic that you were still able to have access to therapists because here in the UK, before the pandemic and everything hit, I was seeing one regularly. But as soon as everything hit its peak over here, the first thing that went was my therapist because she got reassigned to work elsewhere within the healthcare profession because as they're all medically trained professionals over here. And as a result of that, they all had to be reassigned to be where they would be needed most. And mental health care wasn't seen as being a priority.
Yeah, isn't that ironic? Because what we've learned from the pandemic was that one of the greatest concerns coming out of it was people's mental health and how isolation and deprivation from normal activities affected the psyche of so many people.
If I didn't have the support of groups and stuff on Facebook, I would have been totally isolated without seeing anybody because I live over 300 miles away from my family. I wasn't able to see them for 10 months. And it was just like I had no one to talk to. It was just, I was totally alone for 10 months.
Yeah,
Wow.
it's awful.
I'm curious what surprised you all most about the episode because Jennifer said something that surprised me, but I absolutely loved it and found myself scribbling it down. And that is so many times when you're dealing with bullying, people look at it from a negative vantage point. And one of the things I tried to do as a special education teacher was recognize that oftentimes the children who were doing the bullying were children who needed love and support. And I loved what she said about teaching the children about compassion and how important it was to be compassionate. And she recognized out loud as well that not only did the victim need the compassion and need the support, but also something was happening in the bully's life that was causing that child to behave that way. What surprised you most, Nicole?
I had the same thing written down about that bullies are hurt. And I've always said that hurt people,
Yeah.
but I was bullied as a kid because I was different in that I came from a single parent household because my mom passed away when I was 5. So I was different from 90% of probably the kids in my classes. And what I learned, and it's unfortunate, kids, if they're going to bully, they're going to find something. And that was the one thing that kids would be mean. And then they would add, your mom's dead. And it was, and looking back, it's shocking at some of the stuff you can get bullied for. I can't imagine having grown up with my heart defect, knowing that I was different in that way, and then add that on top of it.
Yeah, it's amazing how unkind kids can be. I was always the littlest person in my class, even though I didn't have a heart defect. It didn't matter. I was a little French Italian girl. And I always got picked last for the sports teams, and I got bullied a lot. And I think it's just that I was so tiny that I was an easy victim, or I should say, an easy target. Annie, what surprised you most?
Gosh, a lot of it. I liked how Richard pointed out regarding the bullying that adults bullying adults. And then how Jen was saying about why we need to teach humility and compassion, and how if we had taught these adults who are bullying adults that when they were a younger age, regardless if it was because someone had a medical condition, the color of their skin, or their religion, and etc., I think there would be a lot less need for therapy and a lot more compassion in what we are as human beings. It's tough. It really is tough. Just a lot of it. And then I really enjoyed what Melissa had to say about hearing and validating her son's feelings, because sometimes people just want to jump on somebody and make them either the victim or the bully. And instead, she was able to talk to her son, listen to what he had to say, and then say, it's okay. I hear you. This is exactly a feeling you are feeling, and it's validated. And then she went and did what she needed to do. It sounds like she did it in a way that was compassionate and understanding, and realizing that if this wasn't going to work out in a way that could be done easily, she then did what was necessary to make sure that this ended and this bullying
Yeah.
ended for her child.
Yeah. I loved that story as well.
Mhm.
I thought that was really well done. And I also like how everybody came to Michael's side and said, "Don't beat yourself up. It's really hard to be a parent." And a lot of times we don't know for 20 years whether something we did or something we said was the right thing to do. And I think we're all just doing the best job we can. Ayrton, what surprised you the most about this episode?
Yeah, and it was just hearing them talk about bullying because all through school I was bullied, but the worst bullying I ever got was after my brother passed away. And we didn't know he had a heart defect until after he had died. But some of the things had said to me after that point in time were just absolutely horrific. And even though I kept doing that thing, I kept talking to my teachers, the only thing I ever got told was that it was just attention-seeking behavior or that I was asking for it.
Oh, that is so wrong. I'm so sorry you had to experience that, Ayrton.
I can't imagine. I'm so sorry.
Wow.
Yeah, to this day, my mum doesn't know the things that were said to me about my brother. She knows all about all the other bullying I went through, but I will never tell her the things that were said to me about my brother.
I think that's the toughest part is us keeping things from our parents so that they don't have to suffer what we've suffered on top of all of that, what's going on as well. Yeah.
And I think it's a
Yeah,
very natural thing to do. I don't think I told my parents about all of the bullying I experienced. I did when I feared for my safety. Like I was bullied terribly on the school bus, and it got to the point where I was afraid to be on the bus. So I felt like I had to tell my parents about that. But I certainly didn't tell them about all of the bullying. And I think you were trying to show a kindness to your mother by not sharing that with her because you knew that would have hurt her, and she probably would have become a mama tiger to try and take care of you, Ayrton.
yeah, it was scary enough having to tell her that I developed this heart defect knowing she'd already lost one child to one.
Yeah, that would be hard. That would be so hard. I feel like I am more empowered just from learning from Melissa and Jennifer and Richard. What do you think, Annie?
Yeah, I feel empowered and I also feel heard completely.
Yeah, this was a great episode. I wish it didn't have to end, but Annie, I'm going to ask you to take us out.
I know maybe we can do a part two. Anyways, thank you all for joining us today on the CHC podcast. We hope you'll join us next month for our town hall meeting on relationships in the CHD community. Until then, I'm Annie Ulchak.
I'm Ayrton Beatty.
Have a great day and keep those congenital heart conversations going on Facebook and Instagram. Bye.
Thank you for joining us. The CHC podcast can be heard monthly wherever you get your podcasts. Visit us on Facebook or Instagram to continue the conversations. Join the Hearts Unite the Globe Patreon group and become part of our town hall meetings. It's simple. Just visit www.heartsunitetheglobe.org and select the tab that says Donate to Hug with Patreon. Then you too can be part of the conversation.